Hello, I'm Colonel Whiteley and this is Sergeant Cook. We're here from Medical. So Sergeant Cook, to go on the O&E, how many troops needed last-minute medical waivers?
7.
7. How many actually got waivers and were able to go?
5.
Okay, only 5. I thought the answer was always yes. So medical waivers take time?
Yes, they take about a year.
Okay. Who grants waivers?
The National Guard Bureau.
Okay. So to avoid future fiascos, we need your help. First thing to know, medical is on your side, okay? Medical is on your side. And to help more, we're also going to briefly talk about the following: PHA integrity, documentation from health providers, and waiverable medical conditions. PHA integrity, we need you to be honest when you do your PHAs. Any new medical issues, any significant doctor's visits, and all medications need to be reported. Members sometimes don't realize that their commander has a right to know everything about their health. If you're not honest, you're only delaying the inevitable and possibly jeopardizing a future TDY opportunity. Okay, so let's say you develop a chronic condition and want to stay in the military. Once all that is made known, then we in Medical start to build an application for a waiver. So key point, and this is where we need your help again. The biggest bottleneck for waiver applications is getting outside medical documentation. Sergeant Cook.
So if you need documentation, a medical technician will email you to let you know that it is needed. Most of the time we have you come over and fill out a 2870. We will have you take that 2870 to your health provider. After you get the documentation, or even if you can't, you'll let us know. We can fax the 2870 for you to try and get it on your behalf. But please understand, this is ultimately your responsibility to get us the documentation.
Okay, waiverable medical conditions. There are over 300, some of which are anxiety, depression, blood clots, cancer of almost any type, heart disease, heart attacks, pacemakers, congestive heart failure, diabetes, depression, HIV, hip replacement, rheumatologic disorders including things like lupus, thyroid disorders, anxiety, tuberculosis, and many others.
There are medical conditions that are not waiverable, such as bipolar disorder, severe mental health disorders, and really any medical condition that cannot be controlled with medication, such as hypertension, seizures, diabetes, and others.
The bottom line for medical waivers, okay, bottom line, if you can do your job and your commander likes having you around, odds are extremely good you'll get a waiver. Deployability can be a factor, but not always. So to summarize, PHAs, be honest.
Documentation from your health provider is ultimately your responsibility.
And most medical conditions are potentially waiverable. That's it. So Sergeant Cook, what's the first thing to know?
Medical is on your side.
Right, strength and honor.